reading a lot about what went on at the healthcare conference the other week. Seems like AI was a big part of that. Weight loss drugs were a big part of it. Some deals announced, not as many deals announced as usual. I think VC, there wasn't as much. There was some big strategic deals though, and a little bit of PE, but nothing massive. But AI buzzword, I think that we're hearing. What are you hearing from the care agencies that you work with in terms of areas that they're interested, or what's kind of happening in the operating environment?
Yeah, so there's a lot of new products that do a variety of things. Probably the most prominent in our space is monitoring. When you have a lot of times it's a situation where you have a client or a patient that's in between, being cared for by the family or by a spouse and needing additional care and transitioning into, a true care environment, and putting in these monitoring devices to hear when are there, falls or irregularities or, signs that, the additional care is needed. And so the agencies are, partnering with those systems, but those systems come with some risks. So there's regulatory requirements around it, privacy issues, consents that are needed. Amazon is in the middle of one of those kind of cases, where they have the consumer, you buy your Alexa and use your Alexa, but what about everybody else that comes to your home is being actively monitored, right, that haven't consented. So things like that we're dealing a lot with. We're seeing AI to assist with optimization of schedule, right, in some cases in a way that is caregiver centric, meaning that it follows the caregiver and the patterns of a caregiver. And there are products out there that can predict with, I think, 90+% accuracy whether a caregiver will take a particular shift. So what you're seeing is businesses pulling together, right, and allowing kind of almost like a unilateral workforce, right, that I can borrow from and you can borrow from, and we'll use these tools that follow the pattern of the caregiver. And whenever the caregiver has available time near, where a client has a need, they're using these systems to staff. That creates some, issues around joint employment and things like that, right? Whose caregiver is it at that particular time? But there's a lot of technology that is coming into, our industry and is very effective. And I think that's going to be necessary. We're going to need those type of things as the cost of labor continues to go up, right? As the need for care continues to go up and we continue to lose caregivers to other industries. We're going to need to find ways to be more efficient and provide care, more economically, because right now, at least in the private pay environment, there's not that many people that can afford personal care, traditional personal care, because of all those costs.
I think you hit the nail on the head there. There's certainly a cost component to why this technology makes sense. We don't have enough caregivers to deal with the incoming demand. That's just going to continue to grow into the future. We see it. We worked with a business last year, not in home care, but in the healthcare IT space, that traded, and they provided telehealth solutions, mostly in an inpatient versus outpatient setting. But that company had a sister business that was focused on remote patient monitoring in hospitals and health systems. Then there's other companies like Pocket RN. They work in our space and home care space. They work as kind of an add-on where you have this kind of technology-enabled third-party system where you can go where maybe you can't get access to a caregiver in the moment, but they understand the plan of care. They understand some of the nuances of that patient, and they're able to kind of extend the arms around the patient at a time where you might not be able to get a caregiver. And I think it's just going to lead to better outcomes, especially as value-based care and other types of reimbursement come in, where you want to justify being paid a certain amount and to get there, you need analytics, and obviously, AI technology, it can help with analytics too. But one thing that you mentioned as well was just with remote patient monitoring, the fact that it's an area where folks are trying to cut costs, but they're obviously trying to do better for their patients as well. Are there any that, for people that are listening, are there any types of remote patient monitoring that you know of that that are a good kind of third party that they could look to if they were interested in getting that type of technology? See you smiling. Any that come to mind? I know some that were developed in-house. I know some providers that have done that.
Yeah.
But
yeah, there's a few that we're working with, and I get asked that question a lot. And right now, I have been a little hesitant to recommend anybody because we are literally working on the compliance solution for it, and some of this has to do with, and I don't want to get out over my skis because I'm not the privacy, attorney, but we have a privacy team here, and data security team, and some of it has to do with how those providers identify themselves. Are they an aggregator? Do they actually hold the data, or are they just transferring the data? And that changes what the obligations are between the parties and the contractual obligations and things like that. So what we want to do is get these businesses aligned correctly, right, to make sure that we've got the right category that they're placed in based on the services that they perform, and then make sure that we're buttoned up from a compliance standpoint. So what I would say to the audience is check back in about 3-4 weeks, and we'll be ready to give you some recommendations. And there are a couple of names you would know and market leaders in this space that are being very proactive and making sure that we've got this right. I know I was mentioning to you right before we got on that we just saw a big issue that occurred over the weekend with a pretty significant data breach with one of the EMR systems that has created a lot of havoc across the industry with the providers that were using that particular system, and information has been hacked that relates to the patient information, client information of the provider, right, that was sitting on the system that was hacked, and that's created a lot of upheaval. That has been in another area we've seen a lot of focus on lately is around the HIPAA rules are changing. So around HIPAA compliance, when does HIPAA actually apply? There are a ton of states that either now have or are adopting the state level data security requirements and privacy requirements that are effectively making, even in a non-medical or personal care setting, most of those providers adopt all the components of a compliant HIPAA program, which often has to do more with how you bill for your services than it does what services you provide, right? Whether it's home health or home care. So a lot of activity around that as well. But we'll have something real soon, I think, on the market leaders in the AI space, at least when it comes to monitoring. And then I think there are several businesses out there that are focused on optimization, scheduling optimization, and there's some really, really, really good products, really good, really impressive, that can demonstrate, a pattern of success, right, and show, through objective data what adoption of their software does for a business. So, I'm excited about that too, because I think that type of innovation is exactly what we need.
Definitely do. We definitely need innovation. I think looking at it from a different vantage point, you talked about just HIPAA compliance and different regulations. Are there any, or is there a handful of regulations, or is there a regulation that you've had home care agencies, business owners asking you more about than others?
Right now, I think probably there's, I would say, twofold, and it just has to do with the time of the year. So there's one that has just come up that's a really unique law called the Corporate Transparency Act. And this applies to most businesses. And it's a really unique thing. We've never seen this before in the United States. It's actually anti-money laundering law. That's what it's about. And it requires American businesses that are not otherwise exempted, there are very, very few exemptions, to report their ownership. Who owns, if you own more than 25% of the business, all of your personal information has to be provided so that businesses can't be used as kind of a shield for money laundering, right? To hide, some individuals who are doing things like that. And it applies to any business whose gross revenue is under 5 million. It just went into effect earlier this month, January. And so any new business, that's formed now has to comply with the Corporate Transparency Act. And there are some determinations that has to be made, like who is going to be the agent for these reports that are due, because anytime there's a change in ownership of the business and a new report has to be filed, and there's some pretty heavy penalties for not doing it. It applies to existing businesses next year, right? If it's an existing business that meets the criteria, it'll apply next year unless they make a change to the business this year. So we've been doing a lot of work around business formation and reorganization, where companies are changing, like for example, taking their personal care arm of business and taking it outside of, making a separate entity for that line from their home health, so that they don't have all the regulatory obligations of home health simply by being under the same organization. Or we're seeing a lot of, ancillary businesses, right? We're seeing, focus on, a lot of roll-ups who are, setting up their holding company and figuring out, what their secondary transaction is going to be after they complete their roll-up strategy, and making sure that the company is set up in such a way to make that type of secondary transaction a lot easier, and not have to, reform things once they're created. So in all of those situations, the Corporate Transparency Act comes into play. So, and not a lot of businesses know about that. A lot of folks are not aware about it. So we've been trying to educate as much as possible in some of the things that we've been doing as a firm. The other one that's been a real focus is the recent change from the DOL to the independent contractor standard, and how that impacts home care, because home care has its own rules in some respects when it comes to independent contracting. And you've got, so many platforms now that utilize 1099 workers, right? Whether it's a nurse registry, the virtual marketplaces, now all these consumer directed models that we're seeing at a state level. There's been a lot of our providers are focused in on how do we get involved with these consumer directed models, starting to realize that there's a revenue stream there, where the state, is dictating a lot, and it depends on which state when you look at those programs, but they're dictating what the services are for a patient, how many hours they're eligible, and converting what would otherwise be non-paid care, right, gray market care, into reimbursable care. And a lot of times there's a need for some type of fiscal intermediary there, another business. And so a lot of our clients now are launching or exploring those models, which come with some warts on them, primarily that a lot of them are unionized, have the SEIU right in the center of it. So they're trying to figure out, how do we get involved in these consumer directed programs and limit the risk of the business and limit the risk of unionization across the entire system, the entire entity.
Yeah, I think that makes a lot of sense. We do, we're based in New Jersey, but we work all over. But Pennsylvania is one of those markets where they used to have a lot more of they had greater democratization of their consumer directed model. And then the government changed it. And I think they gave one provider pretty much the I don't want to call it the monopoly, but they gave them a pretty broad range. And I think that upended a lot of business models for certain care agencies. And there's still a lot of agencies that work under kind of dual eligibility with Medicare and Medicaid. There's pretty established path there. But one of the issues now is that there's quite a bit of unionization in that state that you don't always see elsewhere. So really good point that you bring up. Thinking about not necessarily the cost issues that might be inherent in dealing with a union, where you can't necessarily control the wages the same way. Think about reimbursement rates. You know, the final ruling for 24 was better than some anticipated, but it wasn't quite what everyone was hoping for. With a lot of lobbying, what's your kind of take on the reimbursement landscape right now?
Yeah, I think when you're talking about that rule, I mean, I think that is just if you want to even call it a win, right? You know, a temporary, I would call it less painful than everybody was bracing for. But I think CMS has been pretty clear what they're trying to do and what they believe, which is that when it comes to home health, that home health is making too much money on care, and that these rates overall need to be reduced. And they also pat themselves on the back for these behavioral penalties, and that it's been effective. Like, for example, for therapy, right? That they kind of dinged through PDGM therapy reimbursements, and lo and behold, there's fewer therapy visits now. And so, to me, there's going to be sort of a long-term trend that has to be addressed here, where I think CMS is going to continue to cut rates until they think that the margin is acceptable. We've seen that also with the 80-20 rule proposal, right? And putting money into the hands of the caregiver, which is great in theory, right? But when you have the government trying to dictate across all these different programs what the caregiver should get and what the ratio should be to caregiver and business, and you could see from all of the comments and the analysis that was done by DAK and a lot of the providers themselves, that kind of model, that 80-20 model, is absolutely unworkable, and it will destroy businesses. And I don't know that we're going to see that fully flesh out in that way. My money is on that we will not. It will not be an 80-20 rule. I wonder if there will be any rule at all. I think probably something, but those ratios will be different, or there'll be some carve outs. But there needs to be something different. Otherwise, you're not going to see a lot of people, a lot of businesses, stay in that space. So, I think overall, I'd say that this trend is going to continue. The other piece of that is Medicare Advantage, right? And the rates that are paid there, right? And that really has not taken off for like supplemental care services and getting any kind of traction around consistent repeat hours or conversion of clients, right, that are on MA plans into private pay clients. I mean, there's some who will tout some success stories, but by and large, that's been a real challenge. So, we want to be careful that we have sort of this dichotomy of a race to the bottom on the government payor and reimbursement rates, combined with the private duty side getting more and more expensive and only available to the elite, right? And there's a big gap that needs to be addressed.
Yeah, I mean, I think the stat I saw recently, might have been Home Healthcare News, I'm not sure who it was. I think they said 15% of those that need care can actually get it through private pay means.
Yeah.
So that the vast majority of folks that need care in the home are unable to get it unless they go through CMS. And you're right, some of these alternative payment models that they have, that Center for Innovation has come up with of CMS, are really not that great. Every time I speak with a provider, they're not really that excited about these plans, because the only way to really do them successfully is do them at incredible scale. And the reality is most care agencies that are independent are really not operating at the scale where they can extract the kind of cost savings or extract the kind of synergies by working with a plan like that and working with payers. They just don't have the capabilities in-house. And there are some folks that are working from a technology standpoint at kind of integrating for home health, value-based purchasing, value-based care. But I think that's an area that every time I talk to caregivers or go to a conference, everyone always talks about value-based care, but then no one really says in practice how to get there. So
yeah, I think that's that study you're referring to was from Harvard. Harvard did that, and 14% of families can afford private care long term, right? And the rates just keep going up, and that's sort of the dichotomy I'm talking about, right? Is you've got that situation, right, where people can't afford care, and then you've got these consumer direct models, right? And so you've got MCOs and payors that are actually leaning heavily into, what businesses have a large workforce that's a contingent workforce, right? That think of an Uber type model, right? That they can deploy as needed, but don't sit as a labor cost on payroll if they're not being used for our rural markets, right? Areas where we can't find coverage. We've got the care deserts, right? What do we do in those scenarios? So you have, oftentimes it's fascinating to watch. One part of the government, right, that's encouraging that type of model and wanting consumer directed, right? The union sort of stepping in and saying, hey, we'll help these employees, we'll help get them organized and get them the rights that they need, since this is somewhat loosey-goosey, right? And then you've got another arm of the government, namely the Department of Labor, that's saying, hey, these independent contractors, we don't believe in independent contracting, and we're going to really crack down on independent contracting, right? So it's just like, we were talking about Pennsylvania, right? Huge problems in Pennsylvania where the reimbursement rates weren't high enough to compensate for overtime, right? It's normally a family caregiver situation, right? So the providers were treating them as 1099 or not paying them overtime, and then the DOL is coming in and finding that they violated the labor law, right? And if they had followed the labor law according to what the DOL would do, they'd be out of business because they'd have no margin based on the reimbursement rates. So there needs to be some kind of comprehensive solution that can't be led with 80-20, where we focus on the caregiver first. We have to focus on the reimbursement first and make sure there's enough money to go around where businesses will want to invest, right, in this industry and in creating these alternative solutions and great programs for delivery of care, right? But it's a little bit of a mess at the moment from my perspective.
No, I couldn't agree more. It's certainly a dichotomy, and I think the race to the bottom. On the one hand, the cost of care, you want it to come down because you want it to be more affordable for folks. On the other hand, the public sector is overstepping by telling the private sector what type of margins it can earn on some of these businesses, some of these home care businesses. Pennsylvania is interesting because some of the reimbursement rates you have on a Medicaid basis, there's a fairly large Medicaid population there. It's like $20 to $25. Then you're paying caregivers $14 to $18. If you pay time and a half with overtime, you actually have a negative margin. It's not that you don't have margin, you actually have a negative margin. It costs you money. But then if you don't give the overtime, then you lose the caregiver. You probably lose the case itself. So it's definitely a catch-22 in that market. But do you have any clients or any businesses that you work with that actually do a good job in some of those markets? Is there any secret sauce that they have that allows them to operate? Is it just the scale factor? Do they leverage technology like we've been talking about? What do you see some of the better companies doing, if at all?
Yeah, I do. I do think that there are some who have kind of figured it out, right? And it's all management, right? I haven't seen anybody. I've had some clients say that they've cracked the code. I haven't seen anybody crack the code on MA, Medicare Advantage. I think that they're playing the long game because they recognize that from a consumer perspective, MA plans are just going to continue to grab lives and population, and you're going to have to figure out a way to do it. So being an early adopter, but I haven't seen anybody be able to monetize that from my perspective, from what I've seen, in a way that's cash positive. Although, like I said, I do have a couple of clients that say they do. So maybe, and that's all about management and some of these tools that we're talking about, optimization tools, finding alternatives. There's a lot of ways to have a happy, healthy workforce that doesn't turn over, that are not tied directly to you being the highest paid employer, right?
Sure.
Engagement with workforce and things like that. So, we've definitely seen some success stories. And then I think that what we're going to need to see is the government get involved in a positive, holistic way where reimbursement rates actually match. You mentioned, you were talking about Pennsylvania, right? Add to the fact that most of those caregivers are family caregivers, right? So they already have everything that they've got the caregiver, they've got the reimbursement, and now it's almost like they're shopping for the agency. So
Sure.
an agency that says, hey, you're 80 hours, we've got to split that up into 2 caregivers. It's not practical, right? So I think in those situations, that's an advocacy situation, right? There's nothing you're going to be able to do if you can't control the overtime, because you're dealing with family caregivers that will take the consumer or the care recipient away from you, and the reimbursement rate isn't high enough. Then you've got to advocate for a higher reimbursement rate. And then we've seen some success around the country, particularly around Medicaid, where there's been increased rates, and and in some cases it is very profitable. But it leads to this patchwork system, right? That it doesn't lead to a lot of predictability, the ability to forecast, right? Because you think you've got a jurisdiction figured out, and then all of a sudden there's a big cut or something changes, or CDPAP is the same way as what you were saying in Jersey, where the providers are now limited. So it's really hard to predict and scale and to forecast far out into the future, given all the volatility.
I think that's something that buyers are starting to look at too. We talked a little bit about private pay not being the largest of the addressable market, or there's not as much white space in private pay as there is in CMS-based reimbursement. And then there's VA, there's other types of reimbursement that can be pretty, I don't want to say lucrative, but they pay much higher. So it's easier to pay a higher wage and invest in some of the infrastructure operation that can help you scale. But I think one of the things we've seen from buyers is obviously they still love private pay. They love diversity as it relates to reimbursement rates. But we've also started to see them look more at Medicaid, because Medicaid is such, by law of large numbers, a big portion of the spend of the government. There's still that, like you mentioned, every market is different. There's more of a patchwork quilt versus a consistent strategy, which I think, as we think about buyers, strategic buyers, financial buyers, a lot of the financial buyers are colored by their experiences with past or existing portfolio investments. I think some of them that are comfortable with Medicaid, they frankly have an edge, because there is an easier path to scale there, especially if you figured it out in some markets versus another. Although strategic buyers too, I think they've gotten pretty choosy in terms of where they want to invest, but they're also not afraid of some of these other reimbursement types that aren't private pay and aren't as lucrative. I think overall, obviously, like you mentioned, 24 rule is a reprieve, but it's not a solution. I think that's putting downward pressure in some ways on investment in the space, just because of the fact that it's hard with this quote unquote stroke of the pen risk to make sense of what things are going to be like in 5 years, because what people hate the most is uncertainty, especially people making investments, which I think is also a negative for us. But without getting too much in the weeds on it, are there general themes that you've seen around M&A from some of your clients, some of the deals you've worked on?
Yeah, I mean, I think that you're correct with those headwinds, but I think also ultimately it's going to be the aging population that wins the day, right? And
Sure.
so I think we've seen the way that deal making is done change over the years, but we won't see the end of private equity. In fact, I think that that's going to ramp up, right? We'll see more and more investment, and I think that the money is banking on, look, these are the regulatory environment isn't great. There's things that are happening that we don't like. There's some lack of predictability. But at the end of the day, this is a problem that has to get solved, right? Because
Sure.
it comes down to just a simple formula. People are getting older, they need more care, right? And they want it in their home. That's it.
Certainly.
And we have all the technology, all the ability to do that. So the rest of it, we got to figure it out. We got to figure out reimbursement. We got to figure out, the labor shortage, all of those things. So from what I've seen from a deal sense, I mean, we've talked before about 21 was just an absolute banner year. Everything was going haywire. I think comparing 2022 and 23 really kind of gives you a sense of some things where 23 was down from 22. 22 was way down from 21. And I think 24 will rebound from even 23, probably back up to like it was in 22 maybe. But the type of deals, at least that we're working on, and I don't study it probably like you do, right? Because my role is to work on the transactions, but I can just tell you we work with a lot of the strategics and the PE companies that are buying, and what we've seen, at least trending at the end of 23 and so far in 24, the beginning of 24, is a lot of smaller deals, a lot of roll-up strategies.
Sure.
Right, where you've got a talented executive that has rolled off of a deal team for a big strategic that's now got a roll-up strategy, and then a lot more of a targeted. In the old days, well, let me back up and say, I think that there are fewer big assets that are available than we have seen in the past. And I think that buyers have been burned in some instances, right, from casting too wide of a net across too many lines of services, too many jurisdictions, right, where they bought up, and weren't able to operate, right?
Sure.
And so what it seems to me, just anecdotally from the things that we're working on, are smaller deals, more diligence, more time, weighing things. We talked before about how multiples have changed from what they were. So there's kind of an adjustment there. Hopefully interest rates go down as predicted, although, the current signs are they're not going to go down as quickly as some have hoped, and some have said the market is already adjusted for, but that's going to make money a little more available. So I think we'll see, a fair number of transactions in 24, but I think that it's going to be, if you looked at the composition of deals, there'll be, a higher ratio of smaller targeted transactions and a little higher volume in that area.
Yeah, I'd agree with that sentiment. I mean, we definitely didn't see the volume that we saw in previous years last year. I think, even though it was down, upstream, downstream providers completed a good amount of deals. I mean, and thinking about the continuum of care, we had kind of the Amedisys acquisition that was announced by United Health. It's probably one of the larger ones last year at $3 billion. They've signaled more acquisitions are going to be done across the care spectrum, but like you mentioned, there's not as many large assets. But I do think folks that are in that kind of payer space or the network space, the primary care space, I think they're going to come into outpatient healthcare services, and particularly within home-based care. So I think that transaction is indicative of that trend. I know I used to do some work with Gentiva in the past. There was that divestment of that ProMedica did. They're a big hospital health system, mostly acute care, but they divested their kind of skilled medical home-based care businesses within kind of hospice and home health. That one's interesting because you see some of these larger groups doing the opposite of what the biggest groups are doing in terms of protecting the core, or kind of going back to the core to kind of bridge liquidity and refocus strategy. You just mentioned that some groups had overbought and they'd overextended themselves. I think that's something too now, whereas you also mentioned earlier in the call, regulations are changing a good amount. So maybe it does make sense to pick your spot in either maybe medical versus non-medical. Although I do think, given the way things are going from a payer standpoint, reimbursement standpoint, value-based care, there are going to be benefits to folks that are integrated. But for the business owners that we deal with that aren't backed by institutional capital or aren't public, I think that's a little harder to do. So the comment of kind of these smaller roll-ups, tuck-ins makes more sense. Another thing that we saw last year that was interesting was not as many PE exits as we would have thought. I guess with the rate environment being what it was, it's not that big of a surprise. But folks like 10X finally divested Team Select, Webster with Angels of Care, they were both pediatric home health companies. But we're hopeful that this year we see some more of that, because if the private equity firms start to exit, I think that'll be beneficial for everyone. Although, again, if we don't see big changes in rates, depending on where certain sponsors bought in at, that'll have a negative effect on valuations because they might be forced to settle for a lower multiple, and then that'll bring transactions down. But overall, I mean, I feel the same way as you. I just think there are some headwinds, but long term, it's something to figure out. You had mentioned on another conversation that we had the idea of immigration reform being a big part of bringing in more caregivers. And I know in Europe, that's a big way that they're able to build their supply of caregivers. Have your views changed on that at all since we spoke last?
No, I think it's absolutely necessary that we need to do that, but I really don't expect anything to happen there because immigration is such a hot button issue, right? It is such a divisive issue right now, and until and unless border security can be addressed, right? That's got to be the first. Yeah, there's got to be some consensus and agreement on border security, because everything else from an immigration perspective is tainted by that. So, while there's talk about immigration reform and having, a specific visa, like a caregiver type visa, like you see in Canada and other countries, I just don't see it happening, yet. So I think we're a ways off there, which is why, I'm saying the focus needs to be on, education, turning people here into caregivers directly from schools, right? The kind of the workforce initiatives that you're seeing, collaborations between, universities and even high schools and associations and things like that, and then getting the most out of the workforce, right? By creating an environment where it's very easy for them to pick up shifts, they can work what they want to work and feel connected to the organization. That's going to be the short-term solution. As much as you want to call it a solution, but we're going to be plagued with workforce shortage for the next several years. And then I think eventually there will be a reform to immigration, because they're going to have to come from somewhere. And I don't think we can support the need that we're going to have solely in the United States, not the way things are going.
Yeah, I think the demand is far going to outstrip the supply. So I think it's going to be an area that we need to figure out a solution for. And I think ultimately it will be solvable or solved. But to your point, I just don't think there's a political will right now by the legislature to get anything done. I saw that this Congress has been the lowest or the least productive Congress in a very long time.
Yeah, you look at everything delayed and pushed, and it's fascinating. The FTC just did that with the non-compete vote that was supposed to have happened. Right now, that's pushed to April, and it does seem like it's just let's try to read the political winds and decide what to do, and do we want to really put our head up at this stage of the game, only get smashed back down. even joint employment with the NLRB, that's been delayed. I think that's now supposed to go into effect in February, whereas before it was right after Christmas. So there's some delay and certainly a lot of talk and not as much action, which sometimes is favorable, to the industry, and sometimes it's not.
Yeah, couldn't agree more. So to close things out, Angelo, you think about 24. What are your predictions? They can be bold, they can be meek. No right or wrong answer here because they are predictions. But curious, what's at the forefront?
Yeah, to run off of your earlier point about I think that we'll see some mega deals, right? Like the Amedisys, LHC group, right? Where the payor, if the payor gets a massive asset, and I think it'll be the payor that's focused the most on the continuum. I think from a provider perspective, we will see a little more focus, right, on their, and I think a lot of that has to do with the regulatory environment is becoming more and more complex and more localized, where you run your business in one state versus another can be very, very different, right? And what I'm seeing is our clients really getting to their core, or very selective, careful consideration into where they're going to expand. We've been retained a lot more lately to investigate, like I was saying about consumer directed, right? Well, what is the risk? What is the opportunity, right? How do we break in? Who else is in the space? A lot of focus on things like that. When it comes to consumer directed, this is probably a contrarian view, but I think we're going to see a rise and an increase in that model, all at the same time that there's a focus, from a governmental perspective on at least the regulators, right, on limiting that model and eliminating the gig economy as much as possible, because it makes too much sense, right, to do it, at least from an economic standpoint. There are lots of other risks and issues, right, from a consumer protection standpoint. I don't know if you've studied anything on the PAPA situation, where that business was really an expose more than a government investigation, but it's a 1099 type model, a marketplace where you're just connecting the care recipient with the care provider, and tons of issues there of alleged abuse and harassment that went both ways, right? Sometimes it was the client, sometimes it was the caregiver. But having a program or a system without oversight, right, training and supervision isn't the answer either. So I think you're going to see some type of, and I don't know if that will all take shape in 24, but it'll start to happen in 24, where there's almost like a hybrid model where there's some oversight, some supervision that is endorsed, right? That is, we ultimately get there because it's necessary. Almost think of it like as a hybrid employee, right? That doesn't have all the same benefits and fringes as a W-2, but more than a contractor, right? And that type of model gets validated. We are going to see a big uptick, as we did in 23, in government investigations. There's going to be a real focus on referral relationships as these alternative models continue to come out, and everybody tries to figure out, well, what's the the revenue stream here? If I'm providing this to you, but you're providing the care, right? But I'm the management company or the virtual marketplace.
Yeah.
Who am I charging and how? Right? There's going to be a lot of focus on those kind of models. We're already seeing that. A lot of continued investigation into the use of pandemic relief funds, right? So we went through the whole process of the really fraudulent businesses that were the low-hanging fruit. I think now we're going to be in that second layer of folks who receive money, whether it's PPP or the employee retention credits. That's a big focus of the IRS. Provider relief. How did you use those funds? Was it appropriate? Do you need to pay some of that back? Right. But we're seeing the government, setting up settlement programs and extending statute of limitations for those kind of investigations. So yeah, I think we'll continue to see a heavy imprint of the government's hand on this industry, because they clearly think that that is necessary, whether it's the DOL or the NLRB or CMS. A lot of focus on our industry, which will probably separate the wheat from the chaff a little more. We've always been a very, very fractured industry with thousands and thousands and thousands of providers, and I think we're going to continue to see consolidation. It'll never be a consolidated industry, but it'll be an industry of more bigger players, right? And I think I would say that towards the mean, not necessarily a monopoly or these giant players, but you've got the giant deals, a couple of those, and then a lot of these roll-ups, and it'll be the mom and pops, the small ones that are just tired of this, right? That will sell to the mid-sized ones, and the mid-sized ones will now become a little larger. That's what I tend to think, is we're just going to see, by the end of the year, an average agency that's larger in size through consolidation than what we are used to.
I think you have to, especially when some of the markets with the greatest density have had or currently have moratoriums on new agencies starting up. I think that's going to be a big part of it. And I think that after last year with deal volumes being down, especially with the folks that normally do the roll-ups that had that frenetic activity in 21, I think they do need to come back to the table and get some of those deals done, because some of the strategics are a little larger at this point. They're targeting some bigger assets, but you're right, the mom and pops, they're going to be in these roll-ups. And I think it's be interesting to see. I also think adjacent areas of expansion will be kind of interesting. I've heard of care management being an adjacent service line. I've heard of people talking about special types of infusion and other therapies that, kind of put them as an agency at odds with maybe someone more in home health. But I think business owners and entrepreneurs are going to continue to innovate, and I'm excited to see that.